Hi, this is Representative Kurt Mosser, State Representative in the 107th District with my legislative report. We're here today at the second annual Senior Expo at the Elysburg Fire Company. I think, and the seniors that I've talked to also agree, this is an important event and a great event that they enjoy because they're getting a lot of knowledge and information from different vendors and state agencies on services that are available to our seniors. I look forward to this event, and I'm glad that we could share it with the seniors. The reason for this legislative report is for those of you who couldn't make it today, that you can learn some of what the seniors that came today have learned. So let's go around and talk to some of the vendors and learn what services there are out there.
We are here to give out literature related to AARP organization for senior citizens. We basically support the AARP programs by having different benefits available to senior citizens that are 50 years of age and above that would relate to health insurance, life insurance. We have, same thing as Geisinger Gold, we have our own Medicare Part B programs too. As a member, you also have discounts available for lodging, for entertainment. A lot of different available programs out there that we have as a member to belong to AARP. We have applications here available at the expo that are available. You can also go online at aarp.org and find out more information too if you're interested in joining. We also have literature on different things that's legislative stuff that's happening with the state and federal government as far as keeping your Social Security and Medicare benefits intact. We have legislative agents that are working all the time for senior citizens to make sure and protect senior citizens' rights, like I said, in the state of Pennsylvania as well as across the United States. Today we're giving out all types of literature here, like I said, related to the different programs and to different things that are happening throughout with the senior citizens and programs that are happening, as well as things that are actually with interaction with the federal government as far as trying to keep our benefits strong. If there's any other questions, like I said, again, you can go to aarp.org and find more information, or you can call AARP at, there's a toll-free number in Harrisburg. You can go on the toll-free phone line and actually find more information for AARP Pennsylvania.
Hi, my name is Melissa, and I'm from the Community Action Agency serving Columbia, Montour, and Northumberland counties. The name of our company is Central Susquehanna Opportunities Incorporated, or CSO. Hopefully you've seen our name in the news. We were very helpful during the flood last year, and as a matter of fact, we're still helping people with flood-related issues now. We have a lot of different services to offer to the public, and everything that we do is absolutely 100% free of charge. One of the programs that I work with in particular is the food stamp program. I'm able to do applications over the phone, which is great for seniors who can't make it out to the office. It's a very simple process, and it only takes about 10 minutes, and you never have to leave your home. It's that simple. We also do applications for LIHEAP. We have applications for the free cell phone program called SafeLink. We have energy assistance programs, just to name a few things. So if you're interested in any of our programs, I'm located in the Shamokin office, and my phone number is 570-644-6575, extension 102. We also have an office in Danville on Mill Street, and we have an office in Bloomsburg in the Bloomsburg Career Link. So please feel free to visit any of our offices, or you can also give us a call at our toll-free number, which is 1-866-944-9518. You can also visit us on the web at www.sensop.com.
Good morning. My name is Jim White. I work for Visiting Nurse Association out of Shamokin and also Lewisburg Home Health. We are a home health agency, and we are here at the fair today to promote our home health services. We will be 100 years old next March, and we're excited about that. We are offering fleece shots to those that are interested, and also some blood pressure cards to help people monitor their blood pressures, because this is such an important thing with the different diagnoses that we deal with every day. We can come into the home and do any sort of service that you need, nutritional services, hospice care, IV infusions. We have a telemonitor now that is hooked up over your telephone that every day we can get a weight and a blood pressure from you, and we can send that all to your doctor so he knows what's going on a daily basis, which is going to be a big benefit to keep you from going back into the hospital with any relapses, especially if you have congestive heart failure or if you have pneumonias or have had a heart attack. We also have a private duty that will come out to your home and help clean. And we are also promoting today our care center here at Shamokin that is a daycare for the elderly, and we have all sorts of programs that can supply meals and everything for that. Any of this information can be gotten through VNA Health Systems in Shamokin, and our number is 570-648-8989. You can also visit us at vnahs.com on the web.
Hi, I'm Cheryl Donlin. I'm an LPN at the VNA Caring Center. The Caring Center is an adult daily living facility or an adult daycare. We're owned by VNA, and we provide services to adults with functional impairments. Our hours of operation are Monday through Friday from 8 a.m. to 4 p.m. We're located in the old high school on Arch Street in Shamokin. CareerLink used to be in there. Now Luzerne Community College is on the top floor, and we are on the first floor. We provide an alternative to long-term care placement. We also enhance the lives of our clients, and we provide respite for caregivers. When the clients are at our center, we have many activities for them. We have monthly health checks. We do arts and crafts. We do music therapy. We have pet therapy. We have a very friendly, warm, home-like environment there. Our clients enjoy coming. We keep them active. We help them feel useful. We do things like Caregiver Appreciation Night. We're going to have a Veterans Dinner. We've had a Clergy Appreciation Day also. It gives the clients an opportunity to feel useful and do some things to help the community. So for more information, you can call 644-4536.
Hi, we're here with George Flory, and George is with the Northumberland County Human Services Drug and Alcohol Program, sharing services that Northumberland County has to offer for our seniors in the district. George, if you could just elaborate on some of the things that you're talking to our seniors about today.
Well, we're trying to make them aware that abuse of drugs, abuse of alcohol is a treatable situation and not a shame. Too many seniors feel they're embarrassed and they're not like one of those people that are bad, if you will. There's so many services available that we can work with and have great success, not only in just drug and alcohol, but also in mental health and mental retardation. So one wonderful thing about Northumberland County, everybody has the availability of service, whether it be inpatient, outpatient, counseling, or family service available to them, courtesy of the county.
I also noticed some of the brochures talk about aging, medicines, and alcohol, and some of the common pitfalls that might be out there that they should look for with their medications when they are seniors, to watch for when they're mixing that and possibly drinking alcohol.
Well, many times seniors don't realize that you cannot mix alcohol and drugs, particularly the sedating drugs. You don't want to take a sleeping pill and drink at the same time because it only enhances the effect of the sleeping pill. Also, it may interfere with other medications, whether it be heart medication or general medications are not well mixed with alcohol at all. So if you're going to drink, don't take your medicine or just do it very mildly.
Well, we want to thank you here because I think it's such an important thing for our seniors who may need this service, for the agency to be here and talk to our seniors, and they can get some advice and pick up some literature. We're here with Therapy Dog International and Linda Yost with her therapy dogs. Tell me the names of the dogs, Linda.
This is Dale Earnhardt, and that is Buffy Sue. Buffy Sue has been a therapy dog for the last 8 or 9 years. She is 16 years old, and she has 309 visits. Dale is kind of new to the game, and he only has 28 visits. So he's just getting started and loving everybody.
Wow, what a wonderful service you offer here. Talk about the places where the dogs will go in and visit, the different places that you do take the dogs into.
Okay, we go to Shamokin Hospital. We also go to Mountain View up on the hill by Treverton, and we see all kinds of people there. And then we also do program called Tail Wagging Tutors. And Tail Wagging Tutors is a program where we go in and children read to the dogs that have like issues with being shy or speech impediments, and they're afraid to read to the kids, so they read to the dogs. And they do very, very well.
Wow, what a wonderful, wonderful program.
This is Eileen Drummond over here. She's the one that tested my dogs, and she ran the last class that Dale was in.
What might you add about the therapy dogs, Eileen? What could you add to what Linda has said, what these dogs offer?
The thing I have found the best is the smile you get when the residents see them, because this is their friend. They may not want to talk to us, but the dogs always bring that smile, and it actually gets them to interact, where some of them sit and they don't do anything. It's like Linda said, the Tail Wagging Tutor program, we've been working with several of the kids, and last year 3 of the kids I was working with at the Bloomsburg Middle Schools came up 2 levels. I was so proud of them. I wanted to adopt them.
What a wonderful, wonderful service, and I want to thank you both for being here to show our seniors this service, and thank you also for the work that you're doing, not only with the seniors, but for the kids, and I think it's just a fantastic service, but thank you so much for being here. If you could just tell us who you're with, your name, and what the program is all about.
My name is Jamie. I work with Family Home Medical. We are working with a program called We Honor Veterans. It's basically a program that is designed to educate community hospices and the VA community on the unique needs of our nation's dying veterans. It is specific to hospice. We have recently joined up with the Lebanon VA to form the Hospice Veteran Partnership of Pennsylvania. There's probably about, I'd say around 50 members now that we have, and we meet monthly, either in person or via telephone conference, to discuss both veterans issues and hospice end-of-life issues.
And I think this is a great program, because when we met in my office and we talked about the program, you know, you bring up that veterans certainly face different things in their end-of-life years that they have to face than most people would have to face. So I think this is a great program where veterans, you have an understanding of what a veteran's facing as compared to a normal citizen.
Sure, and with hospice, it is holistic care. So we also look at the emotional and spiritual issues of every person. A lot of issues sometimes will arise near the end of death, will be spiritual with regret, or some issues of forgiveness. And also sometimes we might see post-traumatic stress disorder arise, and we are learning on how to recognize the symptoms and what to do at that time to get the person help.
And I think that's important, because I think many people think post-traumatic stress disorder right after combat or right upon the return home, and that can arise late in life. Another program that you do is a veteran-to-veteran volunteer program that you're sharing with our seniors today. Could you just talk a little bit about that veteran-to-veteran program?
Sure. We have recently started the veteran-to-veteran program. What we are looking for is individuals who have some spare time and are willing to go in with our patients into the home, kind of just for companionship services, to kind of have and share that common bond with our patients, and to maybe just be able to have somebody there that the veteran patient that we have might be able to be a little more comfortable with discussing issues of military service, things like that.
Again, thank you so much. I think this is such a great program that Family Medical Home Health has started for our veterans, and for that we want to thank you. If they wanted to get a hold of you, the number that they could contact you, or a website that they could go to.
Sure, they can contact us at 570-339-4049.
Now we're here with Doug from Montour County Veterans Affairs Office. And Doug, if you mind, just share with us some of the things that you're offering here as far as literature goes, and some of the questions you might be getting asked from our veterans here in attendance today.
Mm-hmm. Well, there's mostly 2 things that the 2 most basic questions that we get asked have to do with veterans, service-connected disabilities, and also people wanting to get in, especially seniors wanting to get into the VA healthcare system to get the healthcare benefits. Those are the 2 main things. We have other types of literature we're giving out: suicide prevention for veterans, and homeless veterans. That's two big pushes by the VA recently.
Great. And I see you're here also with the Northumberland County Veterans Assistance. So the big questions have been what you shared. The other information that you have to hand out, I see you have some other pamphlets here.
Yeah, we do have some on voter ID registration, and I think that's mainly it. Oh, and some pamphlets on for Fort Indian Town Gap, the national cemetery that's located down there.
Great. And I also see you have federal benefits here for veterans. And I think it's so important that we share this information with our veterans for all they've done for this great country. I want to thank you for being here and sharing what services you have in Montour County and Northumberland County here with our veterans today at the Senior Expo. If they wanted to reach your office, how would they do that?
Well, the one thing that we stress with the veterans and their families that are coming through is that every county has a Veterans Affairs Director. And so they should try and seek out their local Veterans Affairs Director, because it's very convenient for them to go to their local county office to get help, as opposed to having to travel some distance, to get help for their VA benefits. Like, I know there's county director, or there are veteran service officers, like at the VA medical centers and so forth. And if that's convenient for someone to go there, that's fine. But it's typically much more convenient for them to seek out their local county director and get their help, because we are a well-trained organization. Pennsylvania has a Pennsylvania State County Directors of Veterans Affairs Association. We are highly trained individuals. We do continuing training every year, and we're very proud of the work that we do. And we love to help veterans and their families out. So.
Well, the number for the Montour County Veterans Office would be?
Okay, in Montour County is 570-271-3061.
And I also have the card here for Belinda Albright, who's with Northumberland County Veterans Affairs, and their number down there is 988-4213. 988-4213. Thanks again. And certainly I'm really happy that Senator Gordner could be here today also to share with our seniors some of the information that his office offers and share ideas and things coming out of the Senate with the folks coming through our Senior Expo. Senator, as you are here today, I think our seniors certainly get a lot out of this. I hear a lot of great things about how positive this is for them. What are some of the main questions that are asked when they stop here at your table?
Well, Kurt, first of all, this is a win-win. I want to congratulate you again on scheduling the second annual Senior Expo. The attendance speaks volumes as to the interest in it and support of it. Our office and table has been extremely busy. Folks are interested in the property tax rent rebate program. They're interested in some of the shared ride type of programs, some of the prescription drug type of programs they're interested in. But again, it's a win-win because it allows us to share information with seniors and allows so many of the vendors and service providers to connect with them. And that's always sometimes our challenge, is to make sure that we make that connection, because the programs are out there. And again, we know there is no state that does more for seniors through our lottery system than Pennsylvania. And we do it on a county-by-county basis. We do it on an annual basis. But we want to make sure that they're aware of everything that's out there to offer to them. Even something like a reduced registration for cars and vehicles. For seniors that are still hunting or fishing, there's reduced licenses. And again, some of them are still not aware of that, and that's what an event like this allows us to do, share that information and make sure that even if it's not today, maybe next week or the week after, they come into your office or my office and we help them out with that.
Well, again, thank you. And you're so right. When seniors are coming into our office, oftentimes they have no idea that a lot of these programs are out there and programs that are available for our seniors. So we're always glad to share that. I want to thank you over the past 2 years. You've certainly been a great help to me in getting my feet on the ground as I start out this venture as a state representative. Your office and your staff has been a great resource for me. And thank you again for coming out and sharing your knowledge with our seniors today.
Well, it's great, Kurt. It's a great team effort. It's nice when you have a House member and a Senate member that work together. You and I know when we're in session on a weekly basis, we're in contact about what you're doing in the House, what we're doing in the Senate, and ultimately it's to benefit the folks from my senatorial district and your House district to help them in Harrisburg and know that they have helping hands. So glad to do it and look forward to continue to do that in the future.
Thank you. Today, one of our speakers is Mary Barrett. She's with Northumberland County Area Agency on Aging with the Apprise program. And what she does is talk about Medicare, Medicaid, choices in insurance, prescription drug programs, and options for our seniors.
Your address change at Social Security is vital. It is also your Medicare. It changes your Medicare address. Remember, Medicare is federal. So if a daughter called me, her mother went into a nursing home or assisted living, the bank statement remained the same, and 2-3 years later she wonders why she's not getting any notices from Social Security. We had an increase. I said, did your mother move? Well, she said, not far. We're still in the same county. I said, but did she move? Yeah, well, yes. How long ago? I think it was 3 years. I said, did you call Social Security? She didn't know to. I had one yesterday. That's why it's on my mind. Always keep Social Security informed if you have an address change. And likewise, without saying any of your plans, it doesn't matter. Pick up that phone. If you have someone that has power of attorney for a loved one, and you are enrolled in a health or drug plan, just like your doctor's office, see that they have a copy of it. So that Social Security, that doesn't go there, but any of the plans, you'll be then listed as someone they can speak with. Otherwise, if you have a daughter, or a husband, or a friend, call. They really won't talk to them.
And once you're registered in PACE or PACENet, do you have to re-register?
No, not necessarily. They will send you a letter, and every now and then they do a random check. And it's very simple. I'm doing one now for a woman. It just asks if her income has changed. PACE is extremely friendly. I guess that's the term I'm going to use. They're a state program, and they're a wonderful program.
The only thing with PACE, I experienced is they only handle Pennsylvania. You go out of state.
Well, absolutely. PACE is what we call SPAC. It's a state pharmaceutical assistance program. So it has nothing federal. It's not a federal program. It's not a federal. And they haven't announced their partner this year. It will probably be announced. We're hoping by the end of September. And you will get letters, anyone in PACE. And it will say, we would like to enroll you in our partner plan. If you don't want this, please call. And call that number. Don't call me after January 1st. Yes.
I was just wondering. Now, I have insurance through my husband.
Yes.
I don't even know if they have us even registered in PACE.
Well, you need to call me. Okay? And I have PACE applications on the table there with the Northumberland County Area Agency. I have PACE applications also. Anything with Medicare, we can help you, we can guide you, we can educate you. That's the biggest thing with Apprise. We are educators. And like I said, I had a little humility myself when I went back to school this last month. I mentioned to you, I'm going to stick with the drug plan for right now. The Extra Help is a federal program. I think it's wonderful. What the Extra Help does, if you receive 100% of the program, they'll pay your premium, and your drugs will come down to, I have it here, I'll explain it to you, like anywhere from $1.60 to $6.65, I think, but it works with PACE. The thing is, though, you must be on a drug plan in order for that to work. So if you're on a federal drug plan and you apply for and you receive Extra Help, it will work with any plan. And since PACE partners, it will work with it. You know, this open enrollment period, by the 1st of October, I will have all the new plans. There's always changes. There's always formulary changes. There's always premium changes. So every year, you must keep abreast of that. You really need to know where to go to find out. Now, if you're PACE or PACENet, no, wait for their letter. They will partner you. If you're already in an employee plan, a veterans, a Medicare Advantage plan, you need to call them. Make sure they don't enroll you in the PDP. But everyone that's in PACE will get that letter. After about the 1st of October, I will start doing drug plan comparisons because on the federal site, they should all be downloaded by then. I have envelopes in there. Feel free to pick them up. I just designed a page that you can write your medications on. All my information is there. You can drop this envelope off at any Senior Action Center. You can mail it back to me. I have a return label on it. And once your comparison is done, we'll call and we'll review it with you. Okay? And at that point, if you...
Do you think any of your flyers are going to be left by the time we get
Oh, I brought 350. Oh, okay. I have 2,000 made. And at that point, and don't expect it overnight, because last year Amy and I would get 30 of these back in a week. Well, each one of these comparisons takes us at least an hour. And that's why I'm trying to get a jump on it this year and say, get them back to me, we'll start them, and then you'll get a call back someday, and you'll be surprised. It will be, Mary, this is Mary. I have your comparison complete. Would you like to review it, or would you like to come in and see me? Or maybe I'm going to be at the Senior Action Center in your area next week, and I'll just inform you what's going on.
That's cost comparison. That's what you're talking about.
It's everything. It's premium, formulary, and cost comparison. That comparison will do everything. It's a federal program. October 15th to December 7th, you can change your drug plan. You can change your Medicare Advantage plan. Okay? That's your annual enrollment period. January 1st to February 14th, once again, you can disenroll from a Medicare Advantage plan. Disenroll. You will then return to original Medicare, and you can pick up a prescription drug plan. The little glitch here is, at that point, if you want to get a Medigap plan, I'll help you start looking for a plan, because I always highly recommend that, I don't care whether it's a Medigap or a Medicare Advantage plan, find the one that meets your needs. Find the one that meets your needs.
You don't necessarily need to change, though, when they give you the opportunity.
No.
Okay.
No.
You can just
I myself, I don't change unless I find I need it. I don't change if my drugs are all in the plan and the cost factor is still reasonable. I don't change. The reason we offer the comparison is just for people that don't need to change, because then I would call you up and say to you, June, the plan you're on, your formulary is still there, your premium is reasonable, and I would tell you, but I would educate you and say you could change, but I probably wouldn't recommend it. Many people will stay where they are, but there are those that need to change.
Nobody gets in.
Let me see if I have anything. Like I said, that January 1st to February 14th, if you want to disenroll from a Medicare Advantage plan, call me. It's not that I will make your choice. It's just that I will make sure you know exactly what you're doing. Like I said, I am called a Medicare expert. I'm only an expert because I know who to call. I know the questions to ask. I know what to look for through our conversation. I'll know where to go for you.
This is Kurt Mosser, again with Legislative Report. That's all the time we have for today, but I want to thank you all for watching. If you have any more questions on senior issues or any state-related matter, please call my office. The number will be on the screen. Thanks again for joining us.